Sponsored by theglobaldispatch.com.
Well, welcome back to the show. The flu season is essentially upon us, and there's a wide array of available vaccines available this year. Here to discuss the flu, the vaccines, and Passport Health Services for Travel Health is Duellyn Pandis. Duellyn is a registered nurse, and she is the president and CEO of Passport Health of Tampa Bay. Good morning, Duellyn, and thanks for joining me today.
Good morning. Thank you for having me.
Great.
Glad to be here.
All right, I'm glad to have you. Let's start with the flu. The flu season is upon us, although flu activity is pretty sporadic at best. You are a nurse by training, so to begin, I'd like to have you explain how serious seasonal flu can be, thus explaining why the flu shot is so important.
Okay. Typically, the flu is seen in the tropics, and actually Florida is considered a tropical region year-round. So while many parts of the United States may not appreciate flu year-round, flu in Florida can be quite common even in the summer months. So for us, we really have to use extra caution, get our flu shots early, and most of the time the flu shot itself will only last for a very short amount of time, and that's going to be 4 to 6 months. And that's in the old days, they would always say, get your flu shot in October, because they wanted it to carry over into the heavy part of the flu season for us, which is February and March.
Right.
But now they're seeing that flu is coming earlier and earlier, so they are releasing the doses earlier. We've received shipment in September, and they are telling us to vaccinate as soon as you receive the product. Flu can be, a very deadly disease, and there are many organizations out there that are sponsoring and promoting the benefits of the flu vaccine to alleviate getting the flu. For those that are young and healthy, you think that we're not going to be affected, and many times we are. So it's not just the young and the old that can be symptomatic and even die from influenza. More people die from flu than of cancer. When you think of the numbers on an annual basis, it's more than 36 million people. So you have to really, really believe that the vaccines do work to help protect you.
Okay, I noticed that particularly this year, there's a lot of flu shot options. There's the trivalent, the quadrivalent, nasal spray. Can you help our listeners and help me sort it all out?
Yes, I was actually, this morning I got up and I thought, how many varieties are there? And when you have to choose, you have 9 choices of flu vaccine.
Wow.
And out of those 9 choices, many of the manufacturers, there are a lot of manufacturers out there. So even though there's just 9 choices, there's probably over 20 types that you can purchase. So, and one is not better than the other. If you've got 4 that are manufacturing the same type, they're all going to be just as effective. So let's think about the old vaccine, what we used to get last year. Let's don't talk about this year yet. Let's think about last year, the trivalent. And what that means is that there were 3 strains of flu in the vaccine. And there are, with the 3 strains, those are the most predominant that are circulating. And they base that on the Southern Hemisphere when they get ready to make the vaccine. Now, there are 6 different types that you can get this year of the trivalent. You have a preservative-free, which many people are very concerned about preservatives in their vaccines, so that option is out there. There's the ones that have like a microscopic amount of preservative in there. There's a new vaccine that is egg-free, which is very controversial because for many years, the only thing that we've had was a product that had eggs. So people who had a true egg allergy could not receive the vaccine. Well, there are two products that have come online that are considered egg-free. One is a flu cell vaccine, and it can't completely call itself egg-free, but it is manufactured, and it is appropriate for people who have egg allergies. And the other one is Flu Block. And then there are two, a high-dose vaccine that are for 65 and older, and it is 4 times the normal dose of the regular vaccine. And that's because in the elderly population, they need just a little bit extra to help their immune system build up a good response. And then an intradermal, which is a microscopic needle that's given in a sub-Q tissue in the upper arm. And then the quadrivalent is the same vaccine. It's the trivalent, but they've added one additional B strain, and that's the Brisbane. So there are 4 strains in the quadrivalent, and you have 3 choices: the mist, which goes into the nose, the preservative-free, and then the one with the preservative.
Excellent. Really good information there. Let me switch gears a little bit to travel health.
Okay.
I checked out your website, and you offer every travel medicine service under the sun. It's really amazing. Vaccinations of all sorts, prophylactic antibiotics, antimalarials. And one of the most interesting and essential services you offer is travel health consultation with a travel medicine specialist. So what I'd like you to do, as we're getting short on time, is give our audience a snapshot of what happens when a customer comes to Passport Health for pre-travel consultation.
Sure. The first thing that happens is we schedule an appointment for that person to come in, and they will sit and talk with the provider about their specific trip. And every trip is going to be a different scenario. You know, someone that's hiking Nepal and Kilimanjaro is going to be different than the backpacker in South America. So we tailor what we say to that specific person's trip, to what they're going to be doing, their medical history, you know, whether they're going for a short term or whether they will be there over, several months. And all that has a lot to do with the vaccines that are recommended. Right. So let's consider the Philippines. The Philippines is a really neat place, a great cultural experience. But you've got mosquitoes that carry several different diseases there. So not only do you need to consider routine vaccinations that we grew up with and making sure that we've gotten boosters on our tetanus and measles, mumps, rubella, we also have to consider like Japanese encephalitis, something that many people have never heard of here. But there is a vaccine that can protect you against that. Malaria is we need to prescribe medication for that. And we go into great detail to help the client understand, you know, why it is important to receive these. Now, one thing to remember, and there's a misconception, is what do I have to have? Or what's required to go to the Philippines? Well, many countries don't require you to have anything. And that's where people will travel without any type of protection, whether it's malaria medicine, diarrhea medicine, and then they come home sick because the country that you're visiting doesn't really care whether you get sick or not. They care about what you're going to bring into them. And many countries already have everything, and they don't mind if you bring home a lot of extra parasites and microbes with you. So yellow fever is one of those vaccines that is internationally regulated, and the Philippines, they do mind if you bring yellow fever into their country. So there are specific guidelines that the practitioner has to follow to determine your trip itinerary. Are you going to a country that has endemic yellow fever prior to entering the Philippines? And if that's the case, then you will be required to have the yellow fever vaccine. But otherwise, getting vaccinated and getting protected and coming to a travel clinic is to benefit your health in the long term. Think of it as an insurance policy. You're investing in your health ahead of time so that you're not sick with hepatitis A or hepatitis B forever.
Great. Valuable information there. I'll give you about a minute Duellyn. We got about a minute left, and I'll let you go ahead and talk about Passport Health and other services you guys provide.
Perfect. I do want to clarify, I said 36 million deaths for flu, and it is not million, it is thousand.
Yeah.
I apologize for that. But Passport Health is a specialty clinic. We are nationwide. There are over, I think, about 300 clinics across the United States that provide these type of services for those that travel internationally. Some of them are also certified civil surgeons, so we can do the immigration physicals and complete the I-693 for those citizens or those that want to become U.S. citizens, and we're very excited to do that for them. We work a lot with the Department of Defense contractors, many that are going overseas to the Middle East and to other places to support our nation require pre-deployment physicals, and we can do those start to finish. And they are very detailed and very rigid, like the military. You know, if it says this, you have to do it this way. And so the local practitioners sometimes don't understand all the rules that are associated with that. So give us a call, check our website out, and we'll be happy to get you to the right person to get you taken care of for what your needs are. We are a pre-travel, so we want to make sure that you're safe before you go. And many times that's the case. If you take care of it before you go, you don't get sick when you get back.
Fantastic. Well, we've been talking to Duellyn Pandis, President and CEO of Passport Health of Tampa Bay. Thank you, Duellyn, for coming on the show, and sounds like you're doing a wonderful job over here.
Thank you. If you could visit our website at passporthealthusa.com and find a location near you.
You got it. We'll post that on the website.
Thanks so much. I appreciate it.
All right. Take care.
That was possibly one of the better interviews we've ever done, because I think every single one of us is at least concerned about a flu and or getting a vaccine and that kind of thing. Very, very insightful. So great guest.